let me tell you that I'm very happy that I'm teaching this, because when I was in India, every time I see that in homeopathic pharmacies, you do have biochemic tissue salts available, and you do have Bach flower remedies. And these are the methods that I am working with here in Croatia, and teaching also these methods for European countries, not only for Croatia. And but of course I noticed that at the other song you are not recommending these for your patients, only working with homeopathy. And here in Croatia actually, and in neighboring countries particularly, I somehow raised the standard. I'm teaching this method for around 6 years, 5 or 6 years. And I was also teaching homeopaths to become consultants for tissue salts and facial analysis. And also some of them were studying to become teachers for tissue salts. So I have a teacher in in Serbia, in Bosnia and Herzegovina, and in Slovenia. So also I'm running the programs for teachers of tissue salts and facial analysis. So maybe this will be something that will be interesting to some of you, to start not only practicing this method, but also to be able to teach it. And so somehow, when I was combining these methods, I saw how beautiful it is. Oh, okay, I can share screen now, thank you. And I saw how beautiful it was, and what kind of results it produced when I was using tissue salts along with homeopathy. Let me tell you also a story of how I became a user of tissue salts. Of course, I consider homeopathy as the most powerful method of healing. So I was always thinking how with homeopathy, you can heal so many things. You don't need to worry about health or diseases or anything. So my story with tissue salts actually started in 2011 when I was writing my PhD, and I was so stressed, and I had 3 little children at home and taking care of them, and also writing my PhD at night. So my biorhythm was completely messed up. So not being able to sleep properly. I didn't know that at the time, but my tissue salts deposits in my body were depleted. I was lacking so many minerals because I wasn't sleeping enough. I was tired, I was exhausted. My mind was working all the time. I was writing and studying and so on. So what happened to me is that my hormones, thyroid hormones got disturbed. And also I kept having this suffocating feeling, and my thyroid was enlarged, and I had many symptoms that wasn't really comfortable. I was waking up during the night. Night would aggravate. I would have these suffocating feelings. And of course, I thought, homeopathy would help me, of course. So I tried lachesis or whatever remedy would cover these symptoms. But after taking 5, 6, 7 homeopathic remedies, nothing was helping. And I was like, I was so used to taking something from homeopathy and having great results. My problems would disappear, or my children's symptoms would disappear in a matter of minutes or hours. And I was not able to solve this for myself. So at that time, one of my colleagues told me, why don't you try with tissue salts? They are perfect for your thyroid. So actually then I started reading more about tissue salts, and I learned that there is a very specific tissue salt, number 15, Kalium iodatum, that is like tonic for thyroid. It, you know, it heals the thyroid, and it brings such a, you know, such a balancing feeling for the thyroid. And I ordered it immediately, and I was so amazed because on the first day I started using it, on that first evening and night when I went to sleep, I did not wake up, I did not feel suffocated. And even after taking a couple of my first doses on the very first day, I felt relief. I felt such a relief. And I was taking, I never took any medicines for thyroid, but I was taking it, but I was taking tissue salts only for around a year. And all my hormones were back to normal, and all my, everything went away. So even after I felt the first relief, after first day, I still needed to fill up all the deposits of all the tissue salts that I was missing, that were depleted in my body. So I was really, you know, taking around 150 tablets of tissue salts per day, and I got my health back. So I was so enthusiastic about this. So I started studying it. And I completed a course for a consultant and for teacher of tissue salts. And I've been doing this ever since. So I'm very happy that I can share some of my experiences with you. Perhaps some of you are already, of course, working with tissue salts, or you know for sure some basics, because these minerals are also used in homeopathy. But using tissue salts is something different. It is based on homeopathy, but again, it is a separate method. So I have an hour and a half approximately to give you the basics of tissue salts, of this method, and how you can use it for your practice. And next week, on next Sunday, we also have a lesson of hour and a half about how to make a facial analysis for your clients, so for your patients. So okay, so let's start. Let me tell you from the start what are the benefits for you for studying the tissue salts. Of course, this is only the introduction to this method. If you would like to study this in more depth, of course, I'm open to arranging the courses, full courses, with all the knowledge about all the tissue salts for all the other sound doctors that wish to participate. So I put so many informations inside this presentation, inside this lecture. Please do ask me a question if you have. I think you will like it. So first of all, why should you use this method? It was developed by a German homeopath, and we know that our Samuel Hahnemann, a founder of homeopathy, was also German. So Germans do have a very big role in forming these beautiful methods of healing for the entire world. Then it is a very easy method to study. You have 12 main basic tissue salts, and you have 21 additional tissue salts that are only found in our body in traces, but they play a vital role for our health. For example, the tissue salt number 15 that I mentioned that helped me a lot, this is an additional tissue salt. When I say additional, it means that it is discovered only after the death of Dr. Schissler. So when the medicine got more advanced, so they were able to find all the minerals that we have in our body, and that are in a small quantity in our body. So we have a total of 33 tissue salts. It is so easy to study this compared to 5, 6, 7,000 of remedies in homeopathy. Also, tissue salts can be used for long periods, even if you need them, if if you, I don't know, somebody wants to work on something, on bones or on teeth or I don't know, anything, stomach problems, whatever. So it is perfectly safe to use it for many, many years. You adapt the number of tablets that you need to use, but there is no limitation that you should stop using them after some time. So it is a very easy method to prescribe, and you don't need to be worried if your patients will take too many or take the medicine for too long, and which is not the situation with homeopathy. Also, besides treating some diseases, this biochemic tissue salts can be used for preventing diseases. And I will share with you many cases and many examples on how you can use them for preventing diseases. And it is very easy to combine with homeopathy and other methods. You will love to combine these because it is very complementary. When you can give tissue salts, you can give them in case that you have a doubt which homeopathic remedy to give to your patients. For example, let me give you an example with cough. So with cough, we have like 250, 260 remedies for dry cough. And then you need to take the case, and then you need to investigate at what time the person is coughing, what aggravates it, what ameliorates the cough, and what do they like to eat, are they thirsty or not. So many questions you need to ask before you can find the remedy that is suitable for your patient. But with tissue salts, we have only one remedy for only one tissue salt for dry cough, and that is not mure. So you don't need to ask yourself anything. Somebody comes, it's more like a prescription method, something that pharmacists would use, or doctors that are busy with solving many, many cases in one day. So this method is like, your patient comes in and says, oh, I have a dry cough and I have a fever. And you tell him, okay, so take ferrum phos, take natmure, take 15 tablets per day of each tissue salts, and use it for a week and let me know. So this is all you need to do in your consultation. So it is a very quick method and it is easy to prescribe over the counter. So whenever you're in doubt or you don't have time to take the case, you can give tissue salts. And I will explain why is it good to give this one tissue salt instead of investigating which homeopathic remedy would be the best, because tissue salts work on different principle than homeopathy, and I will go and explain this in more detail later. So also when you're thinking about giving a placebo to your patients when he's doing well and he comes to consultation and your patient expects something, so you give them placebo, you don't need to give them placebo. You gave them tissue salts, which will actually work on their health matters. They will improve their immunity. They will improve, I don't know, we can we can strengthen the lungs. We can, to cherish the thyroid or kidneys or liver or whatever. So actually we can work on something with that patient and give them tissue salts. So which are the examples where, for example, you would use tissue salts instead of homeopathy? So I told you my case when I had thyroid problems, but also when some clients come to see me and they say they cannot fall asleep. They're awake until, I don't know, 2, 3, 4 in the morning, and they have problems with sleeplessness. Then what I do, I can take the case and search for good homeopathic remedy, or I can give them magnesium phosphoricum. This is a tissue salt, and I tell them, take 15 tablets before sleep, and if you cannot sleep, then take another 5 or 10 tablets. Take them as many as you need until you are able to fall asleep. an amazing thing is that they called me the next morning and they say, well, how did you know that I will sleep on the first night that I started using this? I mean, this is amazing. I was able to sleep on the first night. And I say, yes, this is how the tissue salts work. So let me give you an example. If you're thirsty, you crave for water, you are somewhere stuck on the highway and you don't have water with you and you're thirsty, will you take a homeopathic remedy to take away your thirst? Or is it the only solution to have a glass of water? And not only glass of water, but you will take 2, 3, 4 glasses of water because you're very thirsty. So the same way, our body is craving for minerals that the body is lacking. And the body is signaling all the time, I need this tissue salt, I need this mineral, I need this, please give me this mineral. But we cannot recognize the signs if we're not working with this method. And also we're not recognizing the signs that we see on our face. Because when our minerals are depleted in our body, our face starts to change. The color, the brown spots, the I don't know, many signals on the face that are telling us which mineral is depleted, but we do not understand. It is like as if I would start talking in Croatian right now, and I speak Croatian language, and I'm telling you about this method, and I'm really, trying hard to explain how these tissue salts work, but you don't know my language, so how will you understand this? You don't understand me. So the same way our body is trying to tell us, take this tissue salt, but this is the language that we don't recognize, and we don't listen, and we don't hear, and we don't know what our body is telling us. So this way, when we are craving magnesium phosphoricum, this is the, and we're craving that tissue salt. So when this tissue salt is depleted, then sleeplessness will start, pain will start, painful period will start, cramps, stuttering, something in the area where this tissue salt is working, some of these will appear. And the person will start suffering and having problems and having symptoms and maybe developing some terrible disease like Parkinson's disease. And as long as the person is not recognizing the signals, the body sends more and more and more of these signals. And the disease becomes stronger and more difficult to treat, and eventually it becomes a chronic disease. So there is no other option if your deposits of tissue salts are depleted. There is no other option but to take these minerals. And you can take also homeopathy, but you need to see if the cause of sleeplessness is the lack of minerals. Same goes with pain relief, with high fever. These are all the things that I can treat only with tissue salts. I can do a detox of liver or of heavy metals, or treat allergies with tissue salts. And with allergies, I combine tissue salts with homeopathy. I give allergen. For example, now we have ambrosia, people are suffering so much from ambrosia, a pollen allergy. So I give them ambrosia in homeopathic form. But then I give them the salt number 24, arsenicum iodatum. So this is the tissue salt that helps the body to strengthen the reaction of the body, not to react, to strengthen the immunity so that the body would not react to any allergen. So we can treat that. We can lower high cholesterol only with tissue salts. And when I have people come to me asking for help if they have high cholesterol, I only give them tissue salts, and it helps. And within 1 or 2 months, their blood results are perfect. Also with cough, I told you this example, or if a person is exhausted, of course, if you are exhausted, you need to replenish your minerals. So in many, many cases, I don't even use homeopathy. I give first the tissue salts, and then I see if it doesn't help in a matter of, because tissue salts, some of tissue salts are very fast in working. So if I don't see progress in one day, then I can say, okay, the cause of these problems of sleeplessness, of pain, of high fever, the cause is not mineral depletion, because the person still has pain, still has fever, still is sleepless. So I will say then, okay, so let's go to homeopathy, because it is imbalance of the vital force that is causing this disease, these symptoms. So also, this is the prevention method for many difficult diseases. So we can take tissue salts to prevent diseases like Alzheimer and Parkinson disease, all sorts of thyroid disorders. We can prevent high blood pressure, especially if you have in your family the problem of high blood pressure or heart diseases in your family, then you want to prevent this from happening to you. Then you can take tissue salts that are good for high blood pressure and good for heart conditions, and then you can take them in advance, because you make sure that you are never depleted of these tissue salts. And this way you are helping to prevent the forming of these diseases. And also for diabetes and for liver diseases. So for all sorts of difficult states, chronic diseases, you can use the tissue salts. You can use it to boost immunity, and you can use it as a beauty remedy. We have amazing combinations to help you so that your hair would not be gray. You know, young people sometimes have gray hair, and this is too early for them. So if you want to have beautiful hair doesn't fall off, you can use tissue salts to stay fit, to stay young, don't have wrinkles, to balance weight, to balance hormones, to boost fertility. So we have minerals, zinc and selenium in the range of tissue salts products. So these are excellent to boost fertility. So here is the list of 12 tissue salts. Here presented, you have the European numbering of tissue salt and American numbers. The confusion became when Dr. Schissler discarded the salt number 3, calcium sulfuricum, and he continued to work only with 11 tissue salts. So later, when this tissue salt was back into production and back into the range of tissue salts, in Europe, they put this salt on the last place, on the 12th place, and in America, it was put, again on the number 3 place. So these are the differences, and please be aware when you're purchasing first 12 tissue salts, please watch out for the name of the tissue salt you want to use, because if you only tell them the number, you might get the wrong one. So also these are the standard potency, and one of the benefits of using tissue salt is that you don't need to think about which potency you need to give to your patients, which potency to choose. These are standard potencies, either in 12x or 6x. And in India, you have 3x. These are the standard potency, and these are the products you only need to say, I need calcium chloratum or ferrum phosphoricum tissue salts, and they will give you the product that is already pre-prepared in this potency, and you don't have to choose the potency. And this is the list of additional tissue salts that were discovered only after the time of Dr. Schissler. So from number 13 to 33, you have all these minerals that are in 12x potency. So these are such beautiful remedies and have so many functions that are so unique, and you can heal so many states with one of them. Kaliarsenicosum, for example, for panic attacks. You know, for panic attacks, for example, people do say that somebody is hypochondriac or that somebody is panicking and he thinks he has a disease, and he, you know, his heart starts to beat and he's trembling and he thinks, oh my God, am I going to die? And he's rushing to the emergency. And then when he arrives there, the doctor says, oh no, you know, all the results are very good. You are not sick. Nothing is happening. You don't have a heart attack. You're not dying. So please go home. You're panicking. So many times these people will be told that they're only panicking. And this might also lead to depression. They might think that they are losing their mind because they do have symptoms. Otherwise, they would not rush to see the doctor. But what doctors don't know, if they are not using tissue salts, they don't know that if you are lacking this salt number 13, Kalium arsenicosum, and you know that arsenicum, you know, this component of arsenicum in these tissue salts will make a person, you know, panicky, because this is the main remedy for panic attacks, arsenicum album in homeopathy. So if you're lacking this mineral, Kalium arsenicosum, you really would feel that your heart is, you know, pounding, that you're trembling, that you think your heart will stop, you're running to see the emergency doctor, and then it goes away. Okay, but these attacks of panic only occur because this mineral is depleted. And once you replenish this mineral, these symptoms will go away. So I found this so amazing, you know, to have the answers behind some states. And you see that these are real states, that they are not making up their symptoms. And when you're taking your blood results, you will not see in your blood that you are lacking this mineral. You can see that on the face, and you can read about materia medica of this mineral, and then you will find out, oh, this is the mineral that you are lacking. Same story I want to tell you about magnesium phosphoricum. So let me give you an example, and with this story you will see that this is very, very logical how this mineral method is working. So with magnesium, let me ask you, so which of the symptoms do babies have when they are born? In the first 3 months when they are born, babies have problems. And mothers, you know, complain and rush to see a doctor or homeopath because babies have cramps. Cramps are in tissue salts methods are you know, treated with the salt magnesium phosphoricum. Okay, so magnesium phosphoricum is a pain relief remedy. It is for cramps, and of course you can use it for babies for colic. Okay, how did this come about? So how is this baby, and all the babies have cramps, and they have been just born, and for the first 3 months they have cramps. Let's go back to their birth. So when their mother was giving birth, what did she experience during that birth? Contraction and severe pain. Which salt is painkiller in tissue salts method? Magnesium phosphoricum. So the baby is still inside, mother is having cramps, mother is in pain, and these are such severe pains that the minerals, especially the magnesium phosphoricum mineral in the body of the mother, is run out very, very fast. So because mother doesn't have enough magnesium in her body, the pains will start to be worse and worse and worse. And once she depletes all her minerals, the baby has some of the collection of minerals that the baby collected during pregnancy. But since the mother and baby are still attached, mother starts to use baby's minerals. And also baby, to go through birth canal, also needs this mineral to go through the process of birth. Baby is born, and the baby doesn't have any reserves, any deposits of magnesium phosphoricum. And how long does it take for a baby through breast milk to again, and through things that mother is eating, through food, how much time does it take for a baby to replenish this magnesium phosphoricum? It takes 3 months. And after 3 months, the baby has enough magnesium. It got enough magnesium through food, and it doesn't have cramps anymore. So this is the philosophy behind minerals. If your minerals are in order, if you have them in, if they're balanced, they cannot be too high, they cannot be too low, because in both situations, they will produce symptoms and diseases. But if there is a, quantitative and qualitative balance of these minerals in your body, these minerals will help with any situation. With you eat something and the food is, spoiled, and you have, diarrhea. If you have enough minerals in your body to treat this condition, you will not be in severe diarrhea. But if the minerals are depleted, then the thing will go worse. So these minerals are actually helping us to stay healthy, because they're solving each situations that we encounter during the life. And how do we, and everything that we are doing every day, we're studying, we're working, we're driving to work, we're busy, we don't have time to eat, and so on and so on. So, and there's something troubling us, and we need a lecture to prepare, or we need to see, 20 patients today, and we're exhausted. So throughout the day, we were, our minerals were going away. So every time we're doing, so if we're exercising, if we're dancing, if we're staying up late during the night, we will be spending our minerals, our precious minerals that are helping us to stay healthy. So this is the theory behind the tissue salts. The disease will develop only when you don't have enough minerals in your body. That is the time when the problems start. Okay. So this was amazing for me to see this list of these minerals, and especially these additional minerals. They're so beautiful to use in your practice because they can treat allergies, hangover, jet lag, high cholesterol. They can detox the aluminium. This is the salt number 20. They can help with many, many, many things. So with thyroid. So this is a very good, for hair loss. So this is a very good list of remedies. Who discovered this method? So it was Schissler. I will just briefly go through this case, through this slide. I mean, I will not bother you with the history of Dr. Schissler. We will study that in much more details if you decide to study this method. So he lived in 19th century, so that was the time of Dr. Hahnemann. That was the time that homeopathy was very, very popular, and many doctors used homeopathy. That was the time of Dr. Hering, when he opened the first college of homeopathy in the US, in Philadelphia and in Allentown. So this was the time when homeopathy was blossoming in the world. So I will tell you briefly how he discovered this method. So this is his main work. This is the book, Abridged Therapy. So this is the book where he wrote everything he learned about the biochemic treatment with tissue salts. He was born in Germany. He lived his whole life in Germany. He studied medicines in many large cities of Europe. And he always wanted to be a homeopathic physician. So he did really choose, he did study medicine because he wanted to be a homeopath. So he decided to study homeopathy. And these are, you know, three very important German homeopaths of 19th century. So Schissler salts will not be developed and discovered if Dr. Samuel Hahnemann hasn't founded homeopathy previously. And you will see why I mentioned Dr. Hering here also. He is known as father of American homeopathy because he spread homeopathy to US. But he also opened the first college on homeopathy. He prepared many books, 10 volumes of the guiding symptoms of our materia medica. And actually, he was the one that translated the book of Dr. Schissler to English. So this is why he is also important for the method of Schissler salts. Schissler was, you know, very, very fond of homeopathy, but what he didn't find in homeopathy, what he didn't like in homeopathy was he thought it was, you know, there were loose boundaries on how you would accept new remedies or discard some remedies. And he thought that, you know, these things are not founded, you know, these rules for including some remedies in materia medica are not very firm. And he was not happy that there are so many remedies and that you need to, at that time of Schissler, there was only around 700 remedies in materia medica, but still he was not happy. He needed so much materia medica to read and to study. So he wanted to discover something that is more simpler. And this is why his method is, his book is called abridged therapy. So he wanted a method that is easy and only a few remedies to use. And some writers before, some doctors before him influenced him, and it was a Dutch physiologist that first influenced him. And there was also one doctor from Leipzig that he you know, considered the work of Dr. Schissler that were important for the development of tissue salts. But actually what he read was one work when there is a work on cellular research. So this is the first time that in some paper, that was around 1870, when Dr. Schissler found that diseases would develop if there is a deficiency of minerals in our body. So this is what he read in this paper in around 1870. And afterwards, also, there was a work of Dr. Rudolf Ludwig Karl Virchow. He was also a German physician, and he wrote also a work on cellular pathology, where he discovered that the diseases are based upon a change in function or condition of cells in the body. How Dr. Schissler discovered the minerals? He actually did the abduction of human bodies when he wanted to see why this person died of heart attack. So he would discover that in this person died of heart attack, in his heart, where deposits of magnesium phosphoricum should be stored, there was no magnesium phosphoricum there. And other people, somebody died in an accident, nothing related to heart, he would look in the heart and he would find deposits, and a lot of deposits of magnesium phosphoricum. So what he did learn is through abduction of the bodies, of dead bodies, he found out that where these minerals are deposited, in which location, in bones, in brain, in the skin, in the liver, in the thyroid. So he noted where are the deposits of these minerals. And based on that, he started using these minerals to treat diseases. So he worked on the philosophy: if there is a mineral lacking, we need to replenish that. We need to give the exact mineral that, you know, that is lacking. So he published his first work 3 years later in 1873, Abridged Homeopathic Therapy. So it is a short homeopathic therapy, you see. He did consider this to be a homeopathic method, but it is only a short method with only 12 remedies. And but it's working on the different level and working on a different way. His work has been translated first in Medical Investigator in 73, then by Dr. Konstantin Kering in 1875, and then William Borike and Dewey, they published this work, 12 Tissue Remedies of Schissler, in 1888. So this is still the best book you can use on tissue salts, prepared by Dr. William Borike. So one other reason why you should consider using this method in your practice is because homeopaths of that time were so enthusiastic about this, and they accepted these tissue remedies, and they liked using this tissue salts. So even Borike. And what are the principles of tissue salts? The principles are that the human body contains 12 main, the most important, most vital minerals, and they're very essential in maintaining our health. When one of these minerals is lacking, you know, other parts of the body try to help, and then they start using other minerals in other locations, in other deposits of the body. And then not only one disease develops, but 2 or 3 diseases at the same time. So the principle of tissue salts is that you cannot treat this depletion of mineral in any other way, but to replenish them and to restore them with the same mineral. So this is something that is the basic principle. Is this homeopathy? Well, yes or no. So no, because it works in a totally different way. You know, we are not working on vital force. The remedies are not made on the same, you know, on the same principle, similia similibus curentur. So when we take the mineral, they will not produce the symptoms of disease in a healthy person, and we don't work in that way. We only replenish what is missing, and if there is more of some mineral in our body, for example, there is a lot of aluminium or a lot of cuprum in our body, we need to, you know, we need detox. And then also the excessive amount of some tissue salts will also produce diseases. If we have excessive aluminium in our body, then Alzheimer's disease can develop. So we need to either take out the excess of minerals from our body, or we need to take in the minerals that we are lacking. And we are doing this with biochemic tissue salts. So no, it is not homeopathy, but then again, it is used in potencies, because Dr. Schissler was a homeopath, and he decided that these were the best potencies, 6x. And so in a matter of speaking, it is and it isn't homeopathy. So I like to say that it is a branch of homeopathy, something that started from the idea of homeopathy and then became a separate method. Some of the doctors, I mean, they don't need to be skillful in homeopathy yet. They can start studying homeopathy with the other song, for example, start, you know, taking clients and seeing clients for the first time and not being very, you know, very confident about their practice. But using with tissue salts will give them confidence, because it is very easy to treat patients with this method. So what are the differences between homeopathy and tissue salts? So balancing minerals is key in tissue salts, when in homeopathy we're acting on vital force. and not on physical body. So doctors do, if there is something, the doctors that don't support homeopathy, if there is something they will support tissue salts. I have I had many people and that wanted to start learning this tissue salts method only for themselves, you know, for their children, for their family. So they study this only to be able to treat their family. But I also have many doctors and I also have many pharmacists that want to study this method. So it is very easy for them because it is over-the-counter method, you know, you can prescribe very fast. So it is only 33 remedies. You don't need to, you know, have trouble with potencies. They're standard potencies. The form is also different. So tissue salts are usually prepared in tablets, but with these tablets, you also put them under a tongue. You don't swallow it like a tablet, but you put it under the tongue to dissolve. And some producers of tissue salts also produce it in pellets or in powder. With tissue salts, there is one good thing, one very big advantage of using this method is that you can combine as many tissue salts as you want for one patient. So for example, if somebody is very sick, a lot of minerals are depleted, you can give them even all 33 minerals. You can say, take 5 tablets of each tissue salts. So I told you I was using 150 tablets per day because I was aware that I needed, because I never used tissue salts before. So I said, okay, let me balance all my tissue salts, all the tissue salts that I have in my body, let me balance all of them. So I took many tissue salts. And it is a very good. You can, what you do is you dissolve tissue salts in water. So for example, I would put in a glass of water 150 tablets. I would dissolve them and then drink 1 zip at a time. And 1 zip at a time. I don't swallow this little sip, but I still, you know, keep it under my tongue for 10 seconds and then I swallow it. So again, it needs to be absorbed under your tongue. And there is no homeopathic aggravation. You don't need to worry if you have given too high potency or too frequent. There is no aggravation. You can use as many tissue salts as you want. There are some combinations that you can purchase that are already pre-prepared combinations. So it is a very easy method to take.